Students training to be healthcare professionals, for example, doctors, nurses or pharmacists, are currently assessed using clinical exams, where they are watched doing a series of tasks, such as consulting with a patient or assessing someone who is unwell. This is done in a simulated setting so that no real patients are harmed and so all students can be assessed on the same tasks. It is important that students are assessed fairly and that similar standards are used between different medical schools to decide who passes or fails. There is interest in whether examiners in different places all score students at the same level, or whether there are variations in this scoring. This could be unfair to students and potentially unsafe for their future patients if it enabled students with weaker skills to qualify. Until now, it has been hard to compare how examiners from different places score. At Kiel University, a research team has developed a new tool called VESCA that makes it possible to compare scoring between examiners in different locations. As a result, it aims to improve fairness in these exams. Importantly, it imposes only a modest extra demand on clinicians' time. This research was funded by the National Institute for Health and Care Research, NIHR. The VESCA process has 3 main steps. A small number of students, with their permission, are videoed on each of the different tasks in the clinical exam. We developed unobtrusive ways of filming students in clinical exams to avoid adding to the stress of exams. All examiners are asked to score 3 or 4 videos of students after they finish the exam. Examiners from different sites or medical schools all score the same videos. A statistical analysis is carried out, which can then compare examiners in different locations and can be used to adjust the scores for all students, not just the ones who are videoed. As well as developing and testing this, we have studied the accuracy of the adjusted scores and how students and examiners feel about using VESCA and whether they would trust it. We used VESCA to compare examiners scoring in a practice clinical exam that took place in 4 UK medical schools. We found a 16% difference between the examiners in different schools, which is quite substantial and would affect who passes or fails the exam. In contrast, much less difference was seen between examiners at any one site. Our work on the accuracy of score adjustments showed that when examiners in different locations differ by this kind of amount, the majority of students' scores will become more accurate if you adjust them. Whilst this was only a small study within a practice exam, this suggests it may be helpful to use VESCA to compare medical schools more widely in real clinical exams. VESCA could also be useful in countries where there is a national exam, which everyone sits, in order to ensure that it is fair to all students. You can read more about this research in the links below.